I would say before I transitioned, I did not see my life continuing. Shay Cutliff, she, her.
Gender affirming care for me is life. My name is Andrea Montanes. I pronounce it she, her, ella.
I think that hormones were probably the biggest thing for me. It just made me feel like I was in my body for once. My name is Ace Davis, and he, him, his.
I noticed that my patients, when they receive gender affirming care, they instantly get this beautiful smile on their face. My name is Kimberly Keach, and my pronouns are she, her.
For me, finding a medical provider was difficult, in particular when I start to try to understand who I was.
Going to the health department and being mocked, ridiculed, and pretty much put up for display for everybody in the office. I had my fingers crossed that I would be getting my referral to a doctor, a affirming doctor at that. No referral ever came. I never heard anything else from that. So I put myself in a position, Jesus, of exposing myself to, I would say, a dozen or more people. And and that being a huge mistake.
A negative healthcare experience I had accessing gender affirming care was at a religious organization in an emergency room. Once I disclosed to the provider that I was trans, he then made the entire experience about my trans related care, even though that's not what I was there for.
And in moments like that, you think to yourself, if this is how it's going to be, I don't think I can do this too many more times. I don't want to do this.
My advice that I would have for fellow colleagues who are trying to understand gender affirming care is they're still people, and you still have to look at the human aspect of it.
A positive experience I had with a medical provider was when I was finally able to access hormone therapy. They really respected my gender and my pronouns.
He just really made me feel like a person and like I was really important to him. And like the care that I was receiving was just as important as any other care.
At the end, I don't look to acceptance, I look for respect as a human being. The ban of the gender affirming care by the state of Florida means a death sentence.
Where I'm relegated to black market hormones, injecting myself with God knows what.
Having to move, first of all, to a place that had gender affirming care and had access, which would be difficult. I mean, everyone knows moves are costly. Finding new providers is daunting.
Gender affirming care can help a trans patient by just making them feel like a person.
I want medical providers to learn about transgender care because they have to understand it's a human right for us.
Trans people just want to access our basic health care. We're not asking for anything extra, just living our lives. We have families, children, jobs, and we just want to be successful and happy.
If you have a negative reaction towards transgender care, it's probably something personal.
People who don't understand gender affirming care, I would tell them they need to educate themselves. Look at it from a medical perspective, not a political perspective. Medical affirming care literally saves people's lives.